Here at Weill Cornell Medicine, we treat aneurysms from the most simple to the most complex. In doing so, we employ a team approach where multiple surgeons may often be involved with the planning and execution of your surgery.
We're lucky to have access to the latest devices. Really, the strength of Weill Cornell Medicine, vascular and endovascular surgery division's approach to treating aneurysms is our collaborative effort across the group.
So when we think about risk factors for aneurysm formation, we really start to think about social habits and medical history. By far, the number one risk factor is tobacco smoking. And so the best thing a patient can do to lower their risk is to quit smoking as soon as they can. Other medical issues like high blood pressure, high cholesterol can also lead to aneurysm formation in the long run. And then there are some rare genetic diseases such as Marfan syndrome, Ehlers-Danlos syndrome, and some others that can lead to aneurysm formation at actually a younger age.
Patients who may be at risk for aneurysms, such as immediate family members of patients diagnosed with aneurysms or elderly male smokers who are high risk, I think that the screening is the first thing because you want to identify whether you have an aneurysm or not. Ultrasound is a very safe and sensitive test to determine the presence of an aneurysm. And when a patient hears the diagnosis of an aneurysm, they think that there's a ticking time bomb going off, and that's usually not the case. This is a chronic disease. We usually have time to work it up. First of all, many patients may not need them treated at presentation, but they should be followed. If it is something that is of a size that needs to be fixed, I think it's worth taking the time to plan for it appropriately and allow for optimal treatment.
Well, because patients don't often know they have an abdominal aortic aneurysm until it ruptures, screening is really paramount for finding these before they become an issue. Because there are both minimally invasive and more traditional open surgical options for aortic aneurysm repair, it's important to consider the patient's wishes, their family situation, and recovery time when deciding on the best course of action for each person.